I'm here today with Dr. Eric Slattery, a board-certified otolaryngologist and a board-certified neuro-otologist, to talk a little bit about otosclerosis and the treatment STAPEDECTOMY. Hi.
Hi, thanks Michelle. Really appreciate the opportunity to be able to discuss this topic. This is something that I very much enjoy, and so this is a wonderful opportunity to help inform patients.
Excellent. So the first obvious question on my mind is, what is otosclerosis?
Sure. So otosclerosis is a disorder of the ear that happens in the middle ear. So there's the outer ear, there's the middle ear, there's the inner ear, and it is a specific disorder of the bone. Interestingly enough, even though it is a bone disorder and you have bone throughout the rest of your body, it only affects a very small area right at the ear. And specifically, it affects the third hearing bone. There's 3 different hearing bones that vibrate in the middle ear. That third hearing bone is called the stapes bone. And it becomes affected by abnormal bone growth that happens in that area. We don't ultimately know why that happens, but what ends up happening is the hearing bones are meant to move, and when this abnormal bone growth forms, it then causes the stapes bone to no longer move properly. This then causes there to be a decrease in the vibration of the hearing bones, which then decreases the ability for the sound to be transmitted to the inner ear. So the hearing bone's job is to transmit sound from the outer ear into the inner ear, where hearing is then processed. And if that is then not allowed to be transmitted through, it then decreases hearing.
So how common is otosclerosis?
It is not that common. It is actually a fairly rare disorder. However, I do see a lot of it, and the reason is not many doctors and surgeons are skilled in the management and treatment of otosclerosis. So even though it's not common, I do see many patients. It's actually one of the more common disorders that I do see.
Who's most affected by this? Is there a specific kind of gender or?
Sure. Well, anyone can really be affected by otosclerosis. However, there are certain individuals who may be at higher risk. Caucasians, for example, and Latino backgrounds have a higher potential rate for having otosclerosis. Having said that, any race or gender can be affected. Females are more affected than males. Its onset usually is sometime in early adulthood or mid-adulthood, and so often it will first become noticed in someone's early 20s or 30s when it's first being noticed by the patient.
So, Dr. Slattery, what are the symptoms of otosclerosis?
Sure. So the main symptom really is hearing loss with otosclerosis. This happens usually gradually with time. Usually one ear is affected more than another ear. Many times it can only be one ear. About 50% of the time it is both ears eventually, but those usually decrease with their hearing not at the same time. In other words, someone who may have it in both ears, but they'll notice it worse on one side initially. It's gradual in nature. Usually it is not a sudden hearing loss that's noticed. It can take years for this to gradually begin to take effect. The other symptoms that can go along with it, the other main symptom really is ringing or tinnitus. And that is a side effect of hearing loss. Any type of hearing loss that happens, often tinnitus, which is a buzz or a ring of the ear, can also happen associated with hearing loss. So this is not the only symptom that you would see with otosclerosis. In other words, other diseases potentially could have these symptoms, but because hearing loss is a cause of tinnitus, as a secondary cause, often patients will have this ringing or tinnitus as well. Those are the main symptoms of otosclerosis.
So how is otosclerosis diagnosed?
Sure. So otosclerosis really is diagnosed to begin with a hearing test or an audiogram. And so you would have to see an audiologist to have a hearing test performed. On that hearing test, we're able to tell the difference between different types of hearing loss. And the type of hearing loss most commonly associated with otosclerosis is a conductive hearing loss. This actually can be differentiated from other types of hearing loss, such as sensory neural hearing loss. And so the hearing test is the first clue that this is something that's happening. And so with that hearing test, then often other tests may be performed afterwards. Another test that is done is in conjunction with the hearing test is something called stapedial reflexes. Basically what that is looking at how the hearing bones are moving with sound. There is a reflex that is present in the middle ear that allows for changes when there's a loud sound that we can detect. With otosclerosis, often you'll see that absent. And then from there, really it's a conversation with the patient about their treatment options. CT scan can sometimes be utilized as well, and sometimes the abnormal bone formation that is present with otosclerosis can be seen on CT scan. It's not always present, so it's not 100% diagnostic, but if there's a situation in which a patient potentially doesn't meet or seem to have the normal, typical course with otosclerosis, a CT scan can be helpful to help verify that there's not something else happening, and in some cases help show that the otosclerosis is there. However, it's not 100% necessary to have before treatment options are discussed.
Great, thanks. Dr. Slattery, can you tell me, how is otosclerosis treated?
Well, there really are three options for patients. The options are you can watch it, you don't have to do anything. It is a localized disorder to the ear, as we discussed. There is, besides the hearing loss and potentially tinnitus, usually there's not other effects by otosclerosis, and if someone is not bothered by their hearing loss, they can easily watch or observe their hearing loss.
Will a hearing aid?
Hearing aid is definitely a viable option for patients as well, and usually works very well. So hearing aids come in different sizes and shapes, and many of those are very effective for this disorder.
But if you don't want to wear a hearing aid all the time, I understand there is a procedure.
That's correct. There is something called a stapedectomy. Stapedectomy is a type of surgery that can be performed specifically for otosclerosis. Unlike many types of hearing loss, and the most common types of hearing loss, such as age-related hearing loss or noise-induced hearing loss, in which surgery is not an option, for otosclerosis, surgery is an option. And so a stapedectomy is something that can be offered to these patients.
Great, thanks. Can you describe for me what is a stapedectomy?
Sure. Stapedectomy is a procedure that is done for patients with otosclerosis when they meet certain criteria, and the criteria is usually based on the hearing test and a tuning fork exam that it can be done in the office, basically just looking at how they're able to hear and interpret different tuning forks that are placed in and around the ear. Once they meet criteria, we can potentially do the surgery if the patient wishes to have. The surgery can be done either awake or with the patient asleep with general anesthesia. Basically, a small incision is made in the ear canal, and the eardrum is then lifted gently over in order to get a good look into the middle ear itself and the hearing bones. And this really is when when the real diagnosis is made for otosclerosis, as everything else just is by approximation a diagnosis, but once we can actually see the abnormal bone growth and actually see that the stapes bone is not moving well, then we 100% know at that point that we're dealing with otosclerosis. So this would be done at the time of the procedure, and with the eardrum lifted over, then what we would do after we verify that's the diagnosis is with fine instruments and a laser, remove the third hearing bone, the stapes, and then we make a small little incision, small little hole into the inner ear with a laser. We then place a little prosthesis through and then place that on and connect it to the second hearing bone. That then allows bypassing of the fixation point and has a very high success rate, up to 85–90% success, with greatly improved hearing with the procedure.
Wow. Wow, thank you. Dr. Slattery, what can a patient expect with a stapedectomy?
Sure. So the surgery is outpatient, and it can be done in two different ways. The patient can be completely asleep under general anesthesia. In that situation, basically, they're put to sleep, don't remember anything, don't feel anything. The next thing is they're awake. The second way that it can be done is what's called local anesthetic. So the patient can be awake to have the procedure done. In that situation, often they will be given some mild sedation so that they're a little bit more relaxed and calm. They may not remember the entire procedure when that is done. With the procedure in that situation, a patient may recall portions of it, and they may hear certain things that are being done during the surgery. We usually try to alert patients ahead of time so they're not startled. But in general, the procedure is about 45 minutes to an hour operating time. There's usually setup involved as well, and so the total procedure time can be anywhere between 1 to 2 hours in length.
Dr. Slattery, can you tell me about the procedure for stapedectomy?
Sure. So a stapedectomy is basically done either with a patient awake or asleep. And what I then do is make a small incision in the ear canal, gently lift over the eardrum. At that point, we can then assess the hearing bones and 100% make the diagnosis of otosclerosis. With that third hearing bone, the stapes, not moving, we can then see the abnormal bone growth often. We can also see and actually touch gently to make sure that the hearing bones are not moving properly. And at that point, we can then proceed with the procedure. And that is then done with very fine instruments under a microscope. We also use a laser with the procedure. And so what we then do is remove the third hearing bone because it's not moving. And then we make a small little hole into the inner ear with a laser. And then after that's been created, we place a small prosthesis that bypasses the fixation point. So it's now entering into the inner ear, and it is then connected to the second hearing bone, which is now moving freely as it's no longer connected to the fixation point as well. That then allows for a bypassing of the signal directly into the inner ear, and it has a fairly high success rate of about 85–90% success rate of greatly improving the hearing.
What can a patient expect after a stapedectomy?
Sure. So they can go home the same day after the surgery. There often is a little bit of packing that's placed in the ear. There's also could be a drop or two of blood that's behind the eardrum that will muffle the hearing, so they may not notice a tremendous increase in their hearing immediately, although many do, and often that hearing will improve over the next few weeks to even a couple of months after the procedure has been done. The big thing, though, after surgery is that many times, because the inner ear is being opened and it's slightly irritated briefly with the surgery, is that there can be a brief but and temporary dizziness that can happen for a few days to even a couple of weeks after. And that's usually expected with the surgery and is temporary in the vast majority of cases. And most patients are able to do pretty much anything they want after a week or two after the procedure is done. Yeah.
And a week or two, and then 2 to 3 weeks before they'll start noticing the improved hearing.
It can be gradual. Many cases, patients will wake up and report that their hearing is better immediately. They still potentially will have improved hearing even beyond that as some of the inflammation from the surgery, some of the packing is removed later in the office. And like I said, there can be sometimes a little bit of fluid like blood that the body then needs to absorb over the next few weeks. Sometimes patients won't notice it immediately, but yeah, it may be a gradual improvement for some patients. Others, it may be more rapid when they first wake up.
Okay, great. Thank you for telling us about that.
You're welcome. Thank you for allowing me to do this.
My pleasure. Thanks.